Medications for the patient are documented in the BCMA tab, which is right next to the inbox tab. It stands for barcode med administration. When administering the meds, the patient and the medication are both scanned into the system to verify that that is the correct patient, the correct medication, with the 5 rights primarily addressed. Some items that are on the screen that will give you some information about what's going on with that particular item. The meds that have a blue background are actually doses that are in the past that have not been documented. You'll notice that the date and time, it keeps me moving forward, but if I have any doses that weren't charted because the patient wasn't in the room, maybe they went for a radiology procedure, but when they come back I want to go ahead and administer them, you would go ahead and click on the previous button down here at the bottom. Click previous, and it will move my BCMA screen back to the past. So I can see now that I have at 10 o'clock 2 items due, and 11:30 I have another item that was due. Now the X's mean that the order is ready to be given. It's been signed off by pharmacy. I also have signed it off in my inbox, so it's not new to me. The amoxicillin, is a new order, so it will say new on the screen. If I go to the next screen, any orders that were changed will also let you know on the BCMA that they were changed with a CHG. If the pharmacy has not yet signed this off, it will put an REV, and you can also hover over it to be able to see what the information is. But this is a new order as well. This separates your orders from scheduled orders to PRNs. If your medication has a lot of information on it and it runs out of room, so it doesn't fit here, you can hover over it to be able to view all of the information. For instance, here's the sliding scale, and you're able to view all the information about the sliding scale if I hover on it. You can also move this just like an Excel spreadsheet. You can move this over to view more information. If the order has not been signed off by pharmacy, it will not allow you to pull it out of Pyxis, so that's just your notification of whether or not the pharmacy has gone ahead and signed it off. Now, most of the buttons at the bottom you are not going to be using. The previous button you will only see if you do have previous medications that need to be given. The next button will take you forward again to the next section. You'll notice that the previous does disappear when I go back, and I have no more meds that have the blue background, so all of these meds, this is the oldest event that I have in the system. You can also refresh the screen by using the refresh button at the bottom. When you are charting the medications, you will either select the event, or if you have multiple events in one time slot, you can click on the time slot at the top and it will select all of those meds in one session. This way you only have to scan the patient once. You do not have to scan the patient for each med that you are giving. If you had 5 medications to give at 10 o'clock and you only selected the event, you would need to scan the patient's band 5 times. So definitely a time saver if you click on the time at the top, select the entire column, and then you can go ahead and say OK. It will then ask you to scan the patient identification, which is the patient's armband. You will notice that on the armband you have 2 2D barcodes that are on the identification band, as well as a barcode, just the regular line barcode. The 2D barcodes will scan much faster, so please make sure that you are scanning those. They are the same items, it doesn't matter which one you pick. If for some reason the patient does not have an ID band on and you need to override this, That's what the manual override button is. It will allow you to go to the next step, but it will require that if you scan the patient's armband, it will display the patient's number in there, and you would say okay. You can enter the date and time this was performed, but if you're doing it in real time using the WOWs, you would leave this as now. Go ahead and say okay. If the event is not being documented at the time it was originally scheduled for, which was at 10 o'clock because the patient wasn't on the floor, you can click on the document currently selected event to go ahead and go forward. Now, since I had 2 medications that were scheduled to be given, I can go ahead and click this twice. And it opens up and it displays for me my medications that they expect to be given. I do not need to scan the medications in the order in which they display. You can scan them in any order as long as what you're scanning is actually on this list. If you are trying to scan an acetaminophen, it will actually stop you and tell you that you are scanning something that is not on this screen. Since I don't have a scanner while I'm charting these 2 medications, I'll show you what it looks like when you have to override. If for some reason when you're scanning the medications, it may tell you that you can't scan that barcode, it doesn't recognize it, it doesn't know what medication you're meaning, you can always override to continue documenting, but please make sure that you let the pharmacy know that they have a medication that needs to be scanned into the system. Whenever we get new medications, we need to scan the barcode in the pharmacy into the system so we know which barcodes go to which meds. So for this particular example, I'm going to go ahead and just override it by double clicking. If you were to be scanning this, you would not need to click on anything. You would just go ahead and start scanning. So with this example, I'm going to go ahead and double click it. And since I'm overriding it, and if it doesn't recognize what I scanned, it may tell you product ID is not on file. If for some reason your barcode scanner is not working and you just need to give the medication, you can document that as well, but we really encourage you to make sure that you are scanning. Once I've double clicked it, it goes ahead and gets that one ready to be charted and completed. This number turns gray. I can then move on to my aspirin. And I can go ahead and say maybe this is the patient's own medication, and both of them are now gray. I don't have any other fields to go ahead and chart on, so I can go ahead and complete this by administer all and accept. You must click on those 2 buttons or this will not file and your medications won't show that you gave it. So when it comes back to your BCMA, I can now see I have my medications displayed again, and if I go to my previous again, you can see that that 10 o'clock event for July 3rd is now gone. So as I chart my medications, they too will fall off of my BCMA just like on the work list when we chart any other kind of documentation. If a medication is to be given only one time, it will designate it as a ×1 on the BCMA screen. If any of the meds have a condition on them, such as the insulin sliding scale, we do ask a condition to make sure on your honor that you are verifying the dose and type of insulin that you are going to be giving the patient. So I'm going to go ahead and document this digoxin that was due at 1500. I can go ahead, it's a single dose, I can go ahead and just select that particular event. I can then go ahead and scan my patient. And we're going to do it for now, that's fine. It's going to drop me in to go ahead and document that digoxin. And for this example, I'll go ahead and document as if I was scanning the medication. So I scan my medication barcode, say OK, it will take me to then document because this is digoxin for a pulse. So I can go ahead and document the pulse. Everything else is filled in. it does show you what the last pulse was, and because this is the first dose I'm giving to the patient, it will default the answer yes. You don't need to do anything with that other than go ahead and say okay and enter. You can also document if you educated the patient on anything, and you do have a comment section to be able to document any other comments you might want to put in. I can administer all and accept. Now you may not have to give all your meds. Sometimes patients refuse them, or you may not need to give them because of the patient condition. In the instance of insulin, where we take their blood sugar and then we give them insulin according to that result, you may or may not be giving the insulin for that dose. You would go ahead and cancel that particular event if you are not going to be giving it. And that is if you are never going to give it. Do not cancel if the patient is off the unit and you intend to give it after they return. So canceling is very easy. The first thing you do is click the cancel button. It's the third button to the right. Click cancel first. Click the event that you want to go ahead and cancel. This is my insulin right here. I'm going to say okay, and it will ask me why I'm canceling it. That could be because the patient refused the med right here. You can also document, for this example, the blood glucose is not requiring insulin. You can also enter free text, so if it's a reason that's not on this list, you can always enter your own reason. I'm going to go ahead and pick number 15 here and accept the cancel of events. So we took the blood sugar, they didn't need insulin, so basically we're canceling that particular event off of the list. Whether you give the medication or not, you must cancel or document that you gave the medication. As you document the medications, they will update in this last admin column. It will show you the date and time they were last administered. The PRNs, this becomes helpful with because we may need to see when it was last administered, especially if they're a narcotic. When charting your insulin, it takes a couple of extra steps than the regular medications might, such as a pill. You would go ahead and start processing just like you would any other med. You can go ahead and scan your patient, document it for now, and it's going to ask you if the process condition is met. So the process condition is up here in red. Did you verify with another nurse the type and amount of insulin to be given? This is where you're verifying that you did do this and it's on your honor. If you say yes, it will let you go on to the next piece. If not, if you say no, then it will kick you back out and you'll have to start over again. So it's going to display for you the sliding scale, and my screen's a little bit small, so I actually have to scroll down to be able to get to the next step so I can go ahead and chart this. So from here, you may be able to scan the insulin depending on the status in the pharmacy, how they're dispensing the insulin. If you are able to scan it, great. If not, just go ahead and double click it to start processing. I can also say that this is insulin, so then that way they know why I'm overwriting it. It will ask me for the units. Do not put anything in this particular screen, just hit enter. Then when it asks you for the units here, that's where you'll put in how many units you gave to the patient. Then you can go ahead and say accept the auto selection, and this way we can go ahead and charge the patient for that particular amount of insulin. All of your medication charting, when you chart it, we are charging the patient, so we need to make sure that we are always charging the patient and charting for them. Not only for the billing, but also the documentation we have to do. The site that you administered the insulin will pop up. If this had been administered before, you would be able to see the last subcutaneous site displayed right above it. So that way if you want to cycle your sites. I'm going to go ahead and say lateral upper arm. Again, this is the first dose, that's fine. Just hit OK and administer all. All of the AccuChecks will automatically cross into QCPR. You do not need to enter that data into the documentation here. The AccuChecks will automatically cross as soon as you dock your AccuCheck machine. When charting your PRNs, there's obviously no events to click on. There's nothing to select out here. So you will actually need to double click the item itself. So if I want to give my patient a Norco tablet, I can go ahead and double click on that particular item. It'll again ask me to go ahead and scan my patient. I can go ahead and document this for now. And because this is a PRN, it will ask me if the process condition is met. The process condition is if the patient has moderate pain, that we're supposed to give them 1 tablet by mouth. This helps if maybe the patient is having severe pain, maybe they should be taking a different type of medication in order to address that type of pain. But if this is correct, you can go ahead and say yes, the process condition is met, and move on. From here you would be able to go ahead and document by scanning your medication. It would then take you in to go ahead and document their pain level. So I can pick which pain scale I want to use. So the most common is usually the numeric, but you do have the FLAC scale to be able to run you through, and you can answer those questions to give you a pain level. But I'm going to go ahead for this example, pick numeric, say document pain level, and I can go ahead and pick whatever pain level is appropriate. And then you'll be able to document the location. So I want to ask the patient, they say that they are having a problem with their abdomen, and it is uncomfortable, and it's dull and aching, and it's continuous. So I can pick on as many options as I want to put the description in. I'll go ahead and say OK, and it'll ask me if I did any education. This one specifically is about pain medication. If you say yes, it will put in this whole little entry that you instructed them about the pain medication, etc. The reassess in 30 minutes is automatically set to yes. So 30 minutes from the time you actually file this, not the time you say you gave it, this will kick off your reassessment on your work list. That way it reminds you that you need to go ahead and reassess the patient. So I'm going to go ahead and say OK, and this is filled out, it's done, administer all, and accept. Once that's done, again, you would be able to see in the last admin column when that was last given, so that way you know when the next dose would be available. There are a couple of situations where it may look a little bit different depending on what you're able to pull out of Pyxis and how the order is put in. So with the amoxicillin, I'll give an example of when you have to give multiple pills and you're scanning them. So if you need to give 500 milligrams but the Pyxis only has 250, I can go ahead and still double click my item, and I can go ahead and scan my patient. Say I'm giving it now, that's fine. Since I'm giving this late, it will make me put in that I'm documenting the currently selected event to continue, and then I'm going to go ahead and scan my pills. Once I scan the first 250 milligram capsule, it knows that I need to give a total dose of 500 milligrams. So it's telling me that I am under when I scanned one capsule. So if I'm going to continue to give the second capsule to make the 500 milligrams, I then have to scan that second 250 milligram capsule. Once I've done that, then it knows that I've completed with 500 milligrams as ordered, and I can go ahead and say administer all and accept. If you need to give less than what is available in the Pyxis when you pull it, you can document that. It will take you in and show you a little bit different screen just to remind you that you have to give less. The example I'm using here is the Demerol, 50 milligram, and the Pyxis only has 100, for example, so I'm going to go ahead and start processing this as I would any other med. I can go ahead and scan my patient, and I'm going to go ahead and give it now. And from here I would go ahead and scan my Demerol syringe. It will then give me a reminder that I need to give 0.5 portion of this 1 ml with 100 milligrams of meperidine. So that's fine. Go ahead and click complete. This just serves as a reminder. It is showing you that the ordered is 50 and the administered dose is going to show 50 milligrams. So click complete to finish this, and then you would be able to go ahead and finish documenting where you injected, and then you can document the pain level. Again with the education, and say OK, administer all, and accept. So the system knows if you're giving too little, too much, and it will prompt you to make the changes and also to make sure that you are documenting correctly. If you make a mistake with your medications, you can always correct them. You would go to the tab that's right next to the BCMA. It's called the Med IV Summary, Edit, Cancel Meds. This displays for you all of the medications this patient has ordered and may be active. If you have a medication that was a one-time dose and you need to go ahead and edit that one or cancel it, and for some reason, you would hit the expand button first, and it will display in blue the medications that were maybe a one-time order, such as like the Demerol we just charted and the digoxin we charted earlier. Those were one-time doses and they were no longer active, but I still needed to do something with them, so I had to hit the expand button in order to see them. So in order to edit these, the first thing you need to do is click the Admin History button at the bottom. Then it's going to want you to select the medication that you are either correcting or canceling. It will display for you the medication information, what you did. This was the dose that it was scheduled for, and it was actually charted at 15/16. You have a couple of options. You can either cancel the event if you documented it and then the patient refused it when you handed him the tablet, or you can edit the event if you needed to edit anything within, such as the pulse or the amount that you actually gave to the patient. So I'm going to go ahead and just say this was canceled because the patient refused it after I documented it at the bedside. Select the entire column, click OK, and then you can say why. Here's the refused med option right here, and you would accept the cancel. Once that happens, it'll say canceled, but you need to click OK one more time to get a second accept. You have to do this or it will not save the cancellation you just did. So you always have to remember to do 2 accepts. And if you forget how to do this, you can always give me a call. My extension here at the hospital is 4668, and also they know my number in all the units. My name is Andrea. They can get it for you at any time. You're also able to bring back any canceled medications that you canceled before they actually got administered. If they've already been canceled after administration, we can't bring those back, but if a med was canceled because, for instance, the sliding scale, you would be able to bring that back to BCMA if the patient changed their mind and decided they will take their medication. So to bring it back, you would go to the Correct Time Reverse Cancel tab, which is right next to the Med IV Summary Edit Cancel Meds tab, and click on the Med IV Cancel Reversal. Double click the item that you want to bring back. We do have an option to say either canceled in error or the patient changed their mind, and accept. Once you accept it, it will put it right back onto the BCMA in the same place that it was ordered for. So if I go in here and refresh, I can now see if I go to the previous at 13:30, the item I went ahead and canceled is now back. As I said in the BCMAs, you will probably be only using a few of these buttons. The cancel button is one of the most important. Refresh, next. We do have an option to go into review IVs. This is where we would go to actually document our IVs. Piggybacks are still on these scheduled orders on this particular screen, so the review IVs would only be for your bulk IVs such as normal saline and your drips. And that I will cover in the next module.